The paranasal air sinuses are air containing cavities in the bones surrounding the nasal cavity. So, paranasal sinus PNS, they are basically air containing bony cavities. Air containing bony cavities surrounding the nasal cavity, and they are lined by the pseudostratified ciliated columnar epithelium. Pseudostratified ciliated columnar epithelium. One thing is to be noted that the nasal cavity itself is lined by three types of entity. If we consider the nasal cavity around which the paranasal sinuses are present, the nasal cavity is lined partly by olfactory epithelium, partly by skin, that is the vestibule part of nasal cavity, and largest share of the nasal cavity is lined by respiratory epithelium, and that respiratory epithelium is the pseudostratified ciliated columnar epithelium, the same variety which lines the paranasal sinuses as well. So, pseudostratified ciliated columnar epithelium is also known as the respiratory epithelium. Okay. Now, there are four types of paranasal air sinuses, four groups of them on either side, and they are named after the bones containing them. Okay. So, there are four groups located in four different bones. What are the bones? Number one are the frontal air sinuses. Frontal air sinuses. Frontal air sinus, which is located in the frontal bone, as the name suggests. Next, the ethmoidal air sinuses. Number two, the ethmoidal air sinuses. Ethmoidal air sinus. They are present in the ethmoid bone. Next are the maxillary air sinuses. Maxillary sinus, present in the maxilla. And fourth type is the sphenoidal air sinuses, present in the sphenoid bone. The fourth subtype, sphenoidal air sinus, that is present in the sphenoid bone. These sinuses located deep into the skull, and we are seeing them through the skull as if the skull bones are transparent. So, these are the sphenoidal sinuses present in the sphenoid bone. Now, the paranasal air sinuses or PNS, they are arranged in pairs except the ethmoidal air sinuses. Arranged in pairs. That means frontal sinuses are one pair, two in number, one on each side. Maxillary sinuses are one on each side. Sphenoidal sinuses are one on each side. But only the ethmoidal air sinuses, they are arranged in three groups on each side. So seen from each side, there is one frontal air sinus, one maxillary air sinus, one sphenoidal air sinus. These three of them are present in pairs, save for the ethmoidal air sinuses. They are present in groups and they are arranged in three groups: anterior, middle and posterior on each side. So we can divide them anterior, middle and posterior groups. Anterior, middle and posterior groups. Okay. So apart from the ethmoidal air sinus, which is arranged in three groups on each side, anterior, middle and posterior, all the other sinuses are paired. Important to notice that the orbit of the eye serves as a landmark. This is the orbit. This serves as a landmark to appreciate the location and arrangement of the paranasal sinuses. The relationship of the paranasal sinuses to the orbit are as follows. The frontal sinus lie above the orbit. The maxillary sinus lies below the orbit. The ethmoidal air sinuses they are present medial to the orbit, and the sphenoidal sinus, it is present behind the orbit. The sphenoidal sinus, this one, this guy is present behind the orbit. Okay, that is better understood when seen from the aspect of a dry skull. If this is the outline of the orbital cavity, so the frontal sinus is above, maxillary sinuses are below, green, the ethmoidal sinus groups are medial to it, and last but not the least, the sphenoidal sinus group, that is posterior to it. Sphenoidal sinus over here, posterior to it, frontal, maxillary, ethmoidal and sphenoidal. So orbit is acting as an important landmark to appreciate the location of various paranasal sinuses. All these sinuses exhibit two spurts of growth. There are two phases of life when they undergo growth. First, around 7 to 8 years. First one, around 7 to 8 years. And second one at puberty. It is important to be noted that all the PNS are present in rudimentary form at birth. So they are present since birth, except the frontal air sinuses, which start developing 2 to 3 years after birth. So it is the frontal air sinus which is absent at birth and which start developing 2 to 3 years after birth. Regarding the functions of the paranasal sinuses, first of all, as the paranasal sinuses contain air, they are not solid, so first and foremost they make the skull lighter. Number 2, they add resonance to the voice. When the voice is produced, on the way of production, the breath sound is added extra resonance via the air-filled cavities, which are the paranasal sinuses. So resonant voice is produced by paranasal sinus. That's why when the paranasal sinuses are blocked due to sinusitis or inflammation of paranasal sinus, the voice become somewhat blocked, choked or nasal. So the resonance is characteristically absent. Number 3, they act as air conditioning chambers by adding humidity and temperature to the inspired air. Air conditioning chamber. And last but not the least, they also aid in the growth of the facial skeleton after birth. You see, as they are cavities, so they make room for the skull bones to grow up to the puberty. So aid the growth of facial skeleton after birth. Now regarding their clinical importance, the term we must be familiar ourselves with, that is the sinusitis. What is sinusitis? Sinusitis means infection of a paranasal air sinus. Say for example the maxillary air sinus or the frontal air sinus. The infection of any one of them results in sinusitis. When there is infection of paranasal air sinus and resulting inflammation, what will happen? It will be filled with pus or purulent exudates. Clinically, sinusitis presents as headache and persistent thick purulent discharge from the nose. Now one thing it has to be noted that all the paranasal sinuses are present around the nasal cavity and all of them drain ultimately into the nasal cavity. So the drainage of paranasal sinus come ultimately into the nasal cavity. That means when these sinuses are filled with purulent material, purulent secretion, that will result in persistent discharge of this purulent secretion into the nasal cavity, and nasal cavity will release the secretions. Nasal cavity will thrust out the secretions via the external cavity, that is the nostrils. So it will result in persistent thick purulent discharge from the nose as a result of sinusitis. So sinusitis results in discharge from nose, nasal discharge. As well as it will also lead to headache. And to some extent distortion of the normal resonant tone of the voice. The reason of headache is that whenever there is sinusitis, there is irritation of the sensory nerves that are supplying the mucosa of the respective sinuses, and that will result in headache. Now, whenever there is sinusitis, in standard radiological image, the diseased paranasal sinus will show varying degree of opacity. Now, this view, both of them, the first one and second one, are taken in a occipito-mental position. In these views, the paranasal sinuses have been clearly depicted. Now in the second view, you can see the outline of the paranasal sinuses like this, and it presents a overall radiolucent or black colored appearance. You must know that in radiography of the skull, in simple x-rays of the skull, the paranasal air sinuses being air filled, they show radiolucency or black outline because of the presence of air. But in a diseased paranasal sinus, it will show varying degree of opacity or whitishness. So compare the radiograph of one where the right sided maxillary sinus and left-sided maxillary sinus, if compared side by side, we will see that left-sided maxillary sinus is markedly opaque compared to the right side. It is much more white compared to the normal side, that is the right side. So left side one here is the radio opaque side. What I mean to say is that diseased paranasal sinuses show varying degree of opacity, and the newer imaging techniques like CT scan, they provide very clear images of the sinuses compared to the traditional X-rays, which require a very trained eye to pick up any abnormality or relative abnormality of the sinuses compared to the normal ones. Okay. So the disease paranasal sinus in short show radio opacity that I have shown you in this slide. Of course, in this slide you can see the outline of the frontal sinuses over here. To some extent, the ethmoidal air sinuses are also being depicted. Okay. Now I would like to discuss the classification of paranasal sinuses. Clinically, the sinuses are divided into two main groups. First one is the anterior group, second one is the posterior group. What is the anterior group? Anterior group includes those sinuses which drain into the middle meatus of the nasal cavity. You know, all the sinuses are draining into the nasal cavity. To be more specific, into the lateral wall of nasal cavity. If I draw the nasal cavity like this, this one is the lateral wall of nasal cavity. There are two of them, two lateral walls. Now all the sinuses drain into the lateral wall of nasal cavity. Now from the lateral wall there are 1, 2, 3 projections from both the sides. These are bony projections, and these projections from the lateral wall are called the conchi. So there are 3 of them on each side: superior, middle and inferior conchi. So if I draw the lateral walls in an enlarged view, we can see the outline of the nasal cavity like this, where the conchs, the superior, middle and inferior, are coming out from above downwards from the lateral wall. Okay. Underneath each conchi there is a space, and the space underneath the respective conchi, suppose the space underneath the covering of the superior concha is called superior meatus, that one underneath the middle concha is middle meatus, and the one underneath the inferior concha is called the inferior meatus. So in the diagram, the middle meatus on both sides is this one, middle meatus. Okay, middle meatus on both sides is this one. Now what I want to say is that anterior group includes those sinuses which drain into the middle meatus. So anterior group contain those sinuses which drain into the middle meatus. And among them are the frontal, anterior and middle ethmoidal and maxillary sinuses. So frontal sinus, anterior and middle ethmoidal sinus, and the maxillary sinus. These sinuses belong to the anterior group. whereas the posterior group include those sinuses which do not drain into the middle meatus. And the examples: posterior ethmoidal and sphenoidal air sinus. So posterior group contains posterior ethmoidal plus sphenoidal air sinuses. Okay. Now I will discuss the individual sinuses one by one. Next, I would like to talk about the frontal air sinuses. First, let me show you the frontal bone which forms the forehead. This frontal bone has a squamous part which is a large plate-like part which forms the forehead. The orbital plates, two on each side, which form the roof of the orbital cavity. Orbital plates. And a nasal part which overlie the root of the nose in between the orbital plates. Now the outline of the frontal sinuses are as follows. Okay. They are roughly triangular in shape. There are two of them, a pair right and left, and they lie in between the inner and outer tables of the frontal bone, deep to the medial part of superciliary arch. So they lie deep to the superciliary arch. Now you must know that the upper border of the orbital margin is called the supraorbital margin. Above and parallel to the supraorbital margin, on its medial end, over its medial end, there is a rounded curved elevation in the squamous part of frontal bone, and this rounded curved elevation over the medial part of supraorbital margin is called superciliary arch. The frontal air sinus lie deep to the superciliary arch. They lie deep to the superciliary arch. That means superciliary arch is a surface landmark and the frontal air sinuses lie deep to them. Now in the sagittal section, the squamous part of the frontal bone reveals a plate-like bone which is made up of an outer layer, which is also known as the outer table, outer table, and the inner layer that is known as the inner table. In between the two tables of bone lie the frontal sinus. This is the frontal sinus. Okay. The outline of frontal sinus is roughly triangular and they are usually unequal in size and rarely symmetrical. The right one is frequently larger than the left. Triangular in outline. And the right and left, they are separated from each other by a septum, median, almost median septum. So if you take a look at the next slide, we can see the outline of the frontal air sinus, which is roughly triangular like this. And on coronal section, this is the outer table or anterior table, this one is the posterior table, and in between these tables there lie the triangular shaped frontal sinus. Okay. Now each of the frontal sinus, they drain into the anterior part of hiatus semilunaris. What is that? In the lateral wall of the nasal cavity, underneath the middle concha, there is a semilunar cavity, semilunar cleft, which is called hiatus semilunaris. Okay, so hiatus semilunaris is present in the middle meatus. Now the frontal sinus opens into the anterior part of hiatus semilunaris via a duct which is known as frontonasal duct. This duct, which connects the frontal sinus with the nasal cavity, is called frontonasal duct. Okay. As regards measurement of the frontal sinus, the vertical, transverse and the anteroposterior, all these measurements are roughly 1 inch or 2.5 centimeter. Next is the relation. We have to take a close look at the structure to understand the relation of frontal air sinus. The anterior wall is related to the superciliary arch of forehead that have already been discussed. Anterior wall underlies the superciliary arch. What is that? A rounded curved elevation over and parallel to the supraorbital margin. Okay, that is called superciliary arch. Superciliary arch. So anterior wall of the frontal sinus is related to superciliary arch of forehead. In other words, frontal sinuses are present deep to the superciliary arch. The posterior wall of the frontal sinus is related to the frontal lobe of the brain. That is important. Regarding the posterior wall, which is this one in the sagittal section, that is related to the frontal lobe of the brain. That is understandable, because frontal sinus, the posterior wall of frontal sinus, is actually a part of anterior cranial fossa, which lodges the frontal lobe. Frontal lobe of the brain. And regarding the inferior wall, which is this one, this inferior wall, blue colored wall, inferior wall, you can see that inferior wall is related to the roof of orbit as well as partly to the roof of the nose. See, inferior wall is related to the roof of nose, roof of orbit, and also to the ethmoidal air cells which are present medial to the orbit. Inferior wall. In short, in the discussion of frontal air sinus, we get the anterior wall, yellow colored, posterior wall, red colored, and inferior wall, blue colored in the diagram. This is the inferior wall in the frontal view. Okay. As regards the clinical importance of the frontal sinus, there is a term known as frontal sinusitis. Whenever there is an infection of the frontal air sinus, the frontal air sinus will be filled with pus. Pus means the purulent exudates of inflammation. This pus is collected in the frontal sinus and ultimately it may spread posteriorly via the posterior wall. Suppose the pus is located over here. This is filled and distended with pus. Now the pus may break through into the anterior cranial fossa and infect the frontal lobe of the brain. There is a frontal lobe of the brain. That lie like this. That means the pus of frontal sinusitis may spread posteriorly into the anterior cranial fossa, leading to frontal lobe abscess. So that is one route of spread. Or the pus that have been stored in the frontal air sinus may spread inferiorly into the orbit, leading to orbital cellulitis. So one is the frontal lobe abscess, another is the orbital cellulitis. The pain of frontal sinusitis is usually severe and it is localized over the affected sinus. So the pain of frontal sinusitis is felt localized on the forehead region, which is called the frontal headache. Frontal headache. It shows characteristic periodicity. That means it starts on waking and gradually increases and reaches its peak by about midday and then starts subsiding. That's why it is also referred to as office headache. Office headache, because of its presence during the office hours of the day. Okay. Next I will discuss about the maxillary sinus. Maxillary sinus. Maxillary sinus is also known as antrum of Highmore. Antrum of Highmore. It is the largest of paranasal air sinuses which is present in the body of maxilla. This green colored bone is the maxilla, which is an irregular pneumatic bone. Pneumatic because it is air filled due to the presence of maxillary air sinus, and the maxilla of both the side form the upper jaw, upper cheek, and also part of the margins of nasal cavity, you see, as well as orbital margins. Apart from being the largest paranasal sinus, it is also the first to develop. It appears about fourth month of intrauterine life. Fourth month of intrauterine life. It enlarges rapidly during 6 to 7 years and becomes fully developed at puberty after the eruption of permanent teeth. Shape wise, it is pyramidal in shape with the base directed medially, and the apex directed laterally. Base is directed towards the lateral wall of the nose. This is the lateral wall of the nose, and apex directed laterally towards the zygomatic bone. So apex is located towards the zygomatic bone. If we tally the figures side by side, it will be very clear how the base and the apex of the pyramidal shaped maxillary sinus are present on both the sides. Okay. Maxillary sinus appear as an outpouching from the mucous membrane lining the lateral wall of the nose. So mucous membrane that was lining the lateral wall of the nose, they pouch outwards and as an outpouching they give rise to the maxillary sinus. Okay. So it is pretty evident that maxillary sinus, it drains into the nasal cavity, and to be very specific, it drains in the middle meatus, which lies underneath the middle nasal concha, superior nasal concha. This one is the inferior nasal concha. So maxillary sinus is draining in the space underneath the middle nasal concha, and that space is known as middle meatus. Middle meatus. Okay. Now coming to the specific relations of the maxillary sinus. First of all, as regards the roof is formed by the floor of the orbit. First we will mark the roof. The roof is formed by the orbital floor. The roof of maxillary sinus is formed by the floor of the orbital cavity. Roof is formed by the orbital floor. Opposite the roof is the floor of the maxillary sinus, and compared to the roof, the floor is very small. And it is formed by the alveolar process of maxilla. The maxilla presents the alveolar process, which contains the upper jaw teeth, the zygomatic process, which articulates with the zygomatic bone, and the frontal process, which forms the osseous framework at the root of the nose. Now, of these three processes that are seen from the norma frontalis view of the maxilla, it is the alveolar process of the maxilla that forms the floor of the maxillary sinus. The level of the floor of the maxillary sinus lies 1.25 centimeter below the level of the floor of nasal cavity. This is the level of the floor of nasal cavity. This is the level of the floor of maxillary sinus. So from the diagram it is evident that the maxillary sinus floor lies a little bit below. It is 1.25 centimeter below the level of the floor of the nasal cavity. Now it is important to note that normally the root of the first and second molar project into the floor. Normally the root of first and second molar project into the floor. But sometimes the roots of first and second premolar, third molar, and rarely even the canine may project into the floor. Okay. That means starting from canine towards the last molar teeth, all these teeth at some times may project into the floor, which is formed by the alveolar process of maxilla. Okay. Next is the base. The base is formed by the lateral wall of the nose. Lateral wall of the nose. Now if we look at this light, the base possesses the opening or ostium of the sinus in its upper part. So if it is the base, the opening of sinus or ostium of sinus is lying at the upper part of the base. Sinus, the base. That means the opening is close to the roof and it is a disadvantageous position from natural drainage. So if there is accumulation of pus inside the maxillary sinus, that pus have to follow an anti-gravity route. It have to drain against gravity in order to gain entry into the nasal cavity. So that is a bit of unnatural thing. Now normally in a disarticulated skull, if we take the maxilla outside, then we get to see this opening of the maxillary sinus onto the medial aspect of the maxilla. So let us see this opening in an isolated maxilla bone. This is an isolated specimen of maxilla showing the opening of maxillary sinus which is known as maxillary hiatus. It is quite a large opening, but when this maxillary bone is remaining articulated, that means when it is remaining joined to other bones of the nasal cavity, then the maxillary hiatus is reduced into size by the following bones. What are the bones? Maxillary hiatus in an articulated skeleton is reduced by the following bones. Number 1, by the uncinate process of ethmoid. Uncinate process of ethmoid. Number 2, descending process of lacrimal. Descending process of lacrimal. Number 3, ethmoidal process of inferior nasal concha. And last, perpendicular plate of palatine. So this is about the base of the maxillary sinus. Now as regarding the apex of the maxillary sinus is opposite the base. This is the apex, which extend into the zygomatic process of the maxilla. Then regarding anterior wall, it is formed by the anterior surface of the body of maxilla. In order to appreciate the anterior wall, we have to look at this slide from the side. This wall is the anterior wall, and this wall is formed by the anterior surface of body of maxilla, and it is related to the plexus of infraorbital nerves. So this nerve coming out of this foramen, which is infraorbital foramen, is called infraorbital nerve. Infraorbital nerve, after coming out of the infraorbital foramen, forms a plexus that is called infraorbital plexus of nerves. Within the anterior wall runs the anterior superior alveolar nerve in a bony canal. So if we trace the route of the anterior superior alveolar nerve, it is like this. This is the pathway of the anterior superior alveolar nerve within the bony wall of the maxillary sinus. Anterior superior alveolar nerve. It is hereby to be noted that this anterior superior alveolar nerve, it is a branch of this nerve which is passing through the roof of the maxillary sinus. And roof of the maxillary sinus, you know, and you can see in the diagram, it is formed by the floor of the orbital cavity, and this nerve is known as infraorbital nerve. The same nerve which, after giving the anterior superior alveolar nerve, passes out via the infraorbital foramen. This infraorbital nerve is a branch of maxillary nerve. This is maxillary nerve. One of the three terminal division of the trigeminal nerve. The others are mandibular nerve and ophthalmic nerve. So ophthalmic, maxillary and mandibular, these three are the three divisions of the trigeminal nerve. I was into the anterior wall. So the anterior wall is formed by the anterior surface of body of maxilla, and posterior wall, which is lying opposite to the anterior wall, posterior wall, it is formed by the infratemporal surface of maxilla. It is to be noted that maxilla has got an anterior surface which form the anterior wall. This is the anterior surface of maxilla. Opposite to it, this is the infratemporal surface of maxilla. And there is also the orbital surface of maxilla, and another surface that is not seen in this diagram, that is facing towards the nasal cavity, that is the medial surface of the maxilla. Okay. Next we will discuss about the opening of the maxillary sinus. Maxillary sinus open in the hiatus semilunaris. Maxillary sinus, it opens in hiatus semilunaris. This is the hiatus semilunaris. It is a crescent shaped or semilunar shaped opening present in the middle meatus. As you know, middle meatus is a space in the lateral wall of the nose underneath the covering of the middle nasal concha. Middle nasal concha. So into the middle meatus it is opening. The line of opening has been shown in the diagram by a curved arrow. The opening is near the roof of the sinus, and it is a disadvantageous position for the sinus to drain. So drainage of maxillary sinus poses a bit of problem because it is kind of located in an unnatural position. This is not like lateral. Now regarding the nerve supply of the maxillary sinus, it is supplied by anterior, middle and posterior superior alveolar nerves. This is the posterior superior alveolar nerve and this is the middle superior alveolar nerve, and this one is the anterior superior alveolar nerve. The posterior superior alveolar nerve, it is a branch from the maxillary nerve. And the anterior and middle superior alveolar nerve, they are the branches of the infraorbital nerve. Infraorbital nerve. This is the maxillary nerve. Now coming to the clinical importance. Maxillary sinusitis is a very important condition. Maxillary sinus is most commonly infected of all the sinuses due to the following reason. Number 1, infection can reach into the sinus from infected nose. From the nose, infection may get into the maxillary sinus. Then from the teeth, caries teeth, infection may also travel into the maxillary sinus. And also from other infected sinuses that are located in relation to the maxillary sinus, like from infected ethmoidal air sinus or infected frontal sinus. The infection may travel via the nasal cavity into the maxillary sinus. Now, maxillary sinus is the most deep sinus, it is the deepest sinus. That's why in all type of sinusitis, the maxillary sinus carries the chance of being infected because it offers the deepest area for the reservation or for the accommodation of the pus. So having the most dependent part in the floor, this maxillary sinus act as a secondary reservoir. Secondary reservoir of pus, especially from the frontal air sinus. So what is happening is that from the frontal air sinus, the pus is being drained into the middle meatus via the frontonasal duct, and then via the opening of the maxillary sinus into the nasal cavity, the pus that actually comes from the frontal air sinus ultimately drain into the maxillary sinus or ultimately being collected into the maxillary sinus, and it acts as a reservoir of that. Pain of the maxillary sinusitis is referred to the upper teeth and infraorbital skin due to the common innervation by the maxillary nerve. It is to be remembered this upper teeth and the infraorbital skin below the orbit. In both the region, the supply is by the branches of the maxillary nerve. Okay. So let's see the diagram. The supply to the upper teeth as well as to the infraorbital skin all are by the infraorbital nerve and maxillary nerve. That's why the pain of the maxillary sinusitis is referred to the upper teeth and infraorbital skin due to the common innervation by the maxillary nerve. Now regarding the drainage of the maxillary sinus, the opening of this sinus is unfortunately located in the upper part of the lateral wall of the nose, which is a disadvantageous site for natural drainage. So surgically maxillary sinus is drained in the following two ways. Number 1, antral puncture. It is a procedure in which by using trousseau and cannula, okay, we actually invade the maxillary sinus. The trousseau and cannula are passed below the inferior nasal concha. This one is the inferior nasal concha. So the trousseau and cannula is approached underneath the inferior nasal concha in an outward and backward direction. See the direction outward and backward, and ultimately the maxillary sinus is invaded and the pus is drained by irrigating the sinus from outside. Okay, and there is another operation that is called Caldwell-Luck operation, that is outside our scope of discussion. Caldwell-Luck operation. Now regarding the carcinoma or tumor or cancer of the maxillary sinus, it arises in the mucous lining of the sinus. The signs and symptoms produced by the invasion of carcinoma can be easily remembered anatomically. If there is an upward invasion, it will go into the orbit and it will displace the eyeball, resulting in proptosis or protrusion of the eyeball, and diplopia or double vision. If there is downward invasion into the floor, that will produce visible bulge or even ulceration of the palatal roof of the oral cavity. This is the palatal roof formed by hard palate. Into this palatal roof there will be an invasion of the maxillary tumor if it goes down. Okay, if it goes medially, obviously it goes into the nasal cavity, causing obstruction of the nasal cavity and epistaxis. Over there, epistaxis means bleeding from the nose. Also, the obstruction of the nasolacrimal duct in this wall, in the nasal wall, it will produce overflowing of the tears, because tears also drain into the nasal cavity from the ear, from the eyes. From the eyes, tears are draining into the nasal cavity via the nasolacrimal duct. If there is blockage of the nasal cavity by medial invasion of the maxillary sinus tumors, then there will be blockage of the natural drainage from the duct. As a result, there will be excess overflow of tears from the eyes, which is called epiphora. Okay. Then lateral invasion. The lateral invasion produces swelling on the face and palpable mass in the gingivolabial fold. Gingivolabial fold means the fold between the cheek and the upper gum. So lateral invasion produces swelling on the face. Regarding backward invasion, it will involve the palatine nerves, leading to severe deferred pain. If we see into in this picture, a backward invasion will involve the palatine bones and it will result in severe pain in the upper teeth. Okay. Now we will discuss the ethmoidal air sinuses. The ethmoidal air sinuses are made up of a bunch of cells present within the labyrinth of ethmoid, and thus they are located between the upper part of lateral nasal wall. The ethmoidal air sinuses are made up of a number of air cells which are present in the labyrinth of ethmoid. Ethmoidal air sinuses present in the labyrinth of ethmoid. And they are present between the upper part of lateral nasal wall and the orbit. They are divided into three groups. As I have already told, anterior, middle and posterior groups. Let me show you. Anterior group, middle group and the posterior group. There are three groups. The first two groups, anterior and middle, they drain into the middle meatus. So regarding drainage, let's see. The anterior and middle group drain into the middle meatus. The anterior one opens into the hiatus semilunaris. Hiatus semilunaris is the site for opening of the anterior ethmoidal air sinus, and middle one opens on the bulla ethmoidalis, that is a bulge above the hiatus semilunaris. Bulla ethmoidalis, which is a kind of bulge above the hiatus semilunaris, providing the site of opening of middle ethmoidal air sinus. In the hiatus semilunaris opens the anterior ethmoidal air sinus. And the posterior ethmoidal air sinus, the last remaining group, they drain into the posterior part of superior meatus. So in the superior meatus lie the posterior ethmoidal air sinus. Okay. Now discuss about the sphenoidal sinuses. The right and left sphenoidal sinuses lie within the body of sphenoid bone. This is the sphenoidal air sinus. Both the right and left, they are present within the body of the sphenoid bone, above and behind the nasal cavity. This is nasal cavity. Above and behind is the sphenoidal air sinus. They are separated from each other by a bony septum. So in the coronal section we can see there is a bony septum that is separating the sphenoidal sinuses. The two sinuses are usually asymmetrical, and each sinus drains into the sphenoethmoidal recess of the nasal cavity. Now regarding the relation, above the ethmoidal air sinus is the pituitary gland and optic chiasma. So above is the optic chiasma and pituitary. Below is the roof of nasopharynx. Roof of nasopharynx. Nasopharynx is the space behind the nasal cavity. Lateral to the sphenoidal sinuses lie venous channel, which is known as cavernous sinus. So there are two cavernous sinus on both the side of the sphenoidal air sinuses. The internal carotid artery, which lie along the floor of the cavernous sinus, also passes by the side of the sphenoidal sinuses. So lateral relation is cavernous sinus and internal carotid artery. Now in front of the sphenoidal sinus lie the sphenoethmoidal recess. Let me show you the enlarged diagram. In front the sphenoidal sinus, this recess is sphenoethmoidal recess. where the sphenoidal sinuses drain. And behind it, behind the sphenoidal sinus, lie the pons and medulla oblongata. So if I draw the pons and medulla, they are the lower part of brainstem and lie behind it. This is the midbrain. Pons, medulla oblongata. They lie behind the sphenoidal air sinus. So in short, we have discussed the sphenoidal air sinus and its important relation. If we take a look at the horizontal section of the sphenoidal air sinus, let me show you. You can see that in transverse section there are two of them located deep inside the skull. Okay, and the two of the sphenoidal sinuses are seen separated by a median septum, and both of them are present behind the nasal cavity as well behind the orbit, and separated by a thin tiny septum. And behind them lie the pons and medulla oblongata. There is a cut section of the pons and medulla oblongata. That means a cut section of brainstem that is lying behind it. Infection of the sphenoidal air sinus spreading upwards may affect the pituitary gland and optic chiasma. So above the sphenoidal air sinus, if you see the sagittal section, as there is location of pituitary gland above the sphenoidal air sinus, the infection from the sphenoidal air sinus may go upward and may involve the pituitary gland. So that completes the discussion of the sinuses. I hope you should go through your book and complete your study by help of this lecture video.